Okay, for those that are joining us, thank you for bearing with us as we have a little bit of a delayed start, but we're excited to offer you a great session of YP Speaks. We have Ana Paula joining us from Brazil today. So for those that are tuning in, Ana is a trained nutritionist. She has a PhD on public health nutrition specifically. And she's currently working at IDC, the Brazilian Institute for Consumers Defense, and as an associate research at Nupians. So Ana, correct me on pronunciation, but the Center for Epidemiological Research on Diet and Nutrition at Sao Paulo University. So with that said, for those that are tuning in our YP Speaks call, I will be posting the link if you have, for some reason, missed the invitation. So feel free to trickle in. I'll just remind you as well to mute and interfere with all of the information that Ana has presented or prepared for us today. For those that are watching on the Google Plus homepage or our event page, the question and answer box has been enabled, so feel free to chime in if you have questions, and I'll be sure to moderate that and pass them over to Ana as needed. Again, we can be reached at NCD Action on our Twitter account if you have questions that way, but at this time I would like to pass the microphone to today's discussion, so food regulation. Thank you, Ana, for joining us.
Thank you, Desiree, for the invitation. I'm glad to speak to you all today about my work here at Idec. And I will share the screen with you so I can show you my presentation. So everybody can see the presentation? Is it fine?
Yep.
So what I chose to speak to you today is about food regulation in the prevention of NCDs. It's an issue that I've been working for the last 2 years here at Idec. And first of all, as he already presented myself, but I'd like to say quickly that today my main position is a researcher here at Idec. It's the Brazilian Institute for Consumers Defense, and for the last 2 years I've been working on a project founded by RDRC, which is the International Development Research Center from Canada. And I'm also an associate researcher at Nupians, which is a center already that he has mentioned. It's coordinated by Professor Carlos Monteiro. On my PhD, I have studied a different kind of issue. I studied the impact of the Bolsa Família program, which is a cash transfer program here in Brazil, on food acquisition of low-income Brazilian families. And before working here at Idec, I have had a PhD scholarship and a master's degree scholarship. And I have also worked as a consultant at the Ministry of Social Development in this period. So what is Idec first? Idec is an independent consumers association, a non-profit organization founded in 1987. Idec does not accept funds from companies or political parties, neither establish partnerships with them. Its work is maintained by members' contributions, which guarantees our independence and commitment to collective interests. Idec is affiliated to Consumers International and many other national and international networks. Our mission is to promote education, awareness, protection of consumers' rights, and ethics in consumers' relations, with full political and economic independence. And for that, the concept of consumer is not restricted, it's restricted to those who participate in the market, exercising their purchasing power, but also covers those who cannot access essential goods and services due to lack of financial resources. So, talking about our topic today, how food regulation can contribute to the prevention and control of NCDs. It's not me that I'm talking, but the WHO has recently published the recent Global Action Plan for the prevention and control of chronic diseases. I think you all know this document. Specifically in the Objective 3, which is to reduce modifier risk factors for chronic diseases and social determinants underlying the creation of health-promoting environments. The policy options for countries presented by this document are related to tobacco control, health eating promotion, promoting physical activity, and reducing the consumption of alcohol. So what I'm going to talk about is specifically about the health eating promotion. And for this topic, the WHO recommends the implementation of the recommendations about food regulation of marketing and to children, to reduce the level of sodium added to processed foods, to reduce the added sugar on food and drinks, economic tools such as taxes that facilitate the consumption of healthy foods and discourage the consumption of unhealthy foods, and promote nutritional labeling. So the big question is how to do it, where to start, and what is the best strategy for Brazil. Before talking about that, I think it's important for us to discuss a little bit about similarities and difference among countries, because sometimes we can have a food policy which can be applied to all countries, and this food policy will work well everywhere. But there are some other food policies that cannot be implemented by all countries because they have differences regarding their political environments, economical environments, social environment, which will be different according to each country. So for example, I chose to choose one of our biggest similarities, which is that we have 10 transnational companies that control the worldwide food industry. This graphic was developed by Oxfam International, which is an NGO that studied which were the main food industry in the world, and it was published in a very interesting report called Behind the Brands. And after this report, they also started a campaign on the internet to pressure these industries to improve their work regarding health conditions of the workers, the environmental impact of their production. But this document does not include health issues regarding the products that these companies produce, which is one of the limitations of this document, in my opinion, but we can discuss that afterwards if you like to. But I think it's important to show that sometimes people think that, oh, we have options, we have many brands available, we can choose which one we want, but sometimes we don't have many choices, considering that there are only 10 companies that controls most part of what are available for us to buy in the markets. Talking about the difference between countries, I chose an article published last year by Mark Bittman, Michael Pollan, Ricardo Salvador, and Olivier de Schutter, discussing about food policy in the United States. And their conclusion was that the way to produce and consume food has a greater impact on the well-being of Americans than any other human activity. The food industry is the largest sector of our economy. Food involves everything from health to the environment, climate change, economic inequality, and the federal budget. However, we have no food policy for American agriculture management or the food system as a whole. So this article shows clearly that in the United States there is no food policy that includes the issues related to the impact on health and environment of the United States. Here in Brazil, it's different. We have a national food security policy, which is considered very successful. It's not totally implemented yet, but I think it's a different scenario. So we have to analyze, for example, which country has or has not a food security policy, so it can be used as a start to discuss other food policies. And also, I think another similarity are the contradictions between policies for agriculture and for food consumption. On one hand, we have agriculture policies that only benefit the most the agribusiness industry here in Brazil, for example. But we know that this kind of industry is not the one who produces health and adequate food for everybody. So on one hand, this agribusiness industry is producing grains and other goods for exportation, and they receive a lot of government money for that. And we don't want this kind of agriculture to be the basis of health and sustainable diet for us. So, as I mentioned, in Brazil, we have national guidelines. For example, we have the National Policy for Food and Nutrition. We have the National Plan on Food Security. We have a national plan for the prevention and control of NCDs. We also have appropriate legislation regarding Consumers Protection Code, protection of children and adolescents, and also the Federal Constitution, which are considered very broad and important legislation for the protection of our health and for the protection of consumers' rights. However, the structure of the food regulation here in Brazil is diffuse and contradictory. For example, we have many ministries and agencies that regulate some part of the food system here, but not always they are talking to each other, so they can organize the legislation to be in the same way. And most of them are not following the same path. So for the Ministry of Agriculture, they think that they need to improve the agribusiness industry. For the Ministry of Social Development, they need to increase the family farming, the organic production, and these ministries, they are from part of the same government. We also have another challenge, which is to discuss the food regulation in Mercosul, which is the union of some countries from South America, such as NAFTA, the United States, which is a commercial agreement between these countries, and all kinds of regulation regarding, for example, labeling. We need to approve that in the Mercosur meetings, and this must be approved by consensus. So all countries need to approve and be in accordance with this new food labeling regulation, for example, which is a very big challenge for us. Also, before start talking about my work here specifically, I just would like to highlight that we have new dietary guidelines for the Brazilian population, which were published in the end of 2014, and these guidelines are not policy. It's not a policy, but we believe that this will be an important instrument to improve food policies here in Brazil, as it brings new new strategies and new formulations regarding how we need to advise people about food, what people should eat. And I was part of the team together with Professor Carlos Monteiro that elaborate these guidelines. I'm not going to speak about them today, but we can discuss about it later. And I can put the link in the questions. I don't know if you can access now, but I can send you this presentation and the links for you to download this document later. So now, talking about our project here at Idec, which was called the Effectiveness of Brazilian Public Policies that Address Unhealthy Diets. As I mentioned before, it was financed by RDRC. So the general objective of our project was to evaluate the effectiveness of public policies in Brazil, include regulatory and voluntary approaches that aim to address the advertising and labeling of food products that increase the risk of NCDs. Our first objective was to establish consumer knowledge, behavior, perception, and preferences regarding food labeling, including sodium and other food nutrients that can influence on NCDs. For this project, for this study, we did a survey with more than 800 women of all income levels, and we had an hypothesis that women with NCDs may have a different perception and knowledge about food labeling than those who did not have NCDs. But this hypothesis was not correct. We have concluded that having or not having NCDs had not influenced on consumers' perceptions and attitudes regarding food labeling. This was a first Brazilian study about this issue. And it showed that the Brazilian population still have many doubts about the information available in packaged foods, even if they have or they don't have NCDs. It was conducted in 4 large Brazilian cities from each part of the country, so in the south, in the northeast, in the north, in the central parts. So we chose 4 different cities for us to have an idea of what's happening in many different parts of the country. Of course, it was not a representative sample of the population, but it was an interesting sample for us to understand a little bit about what's happening, what people think about food labeling. So briefly talking about the results, I'm sorry I didn't have time to translate this part of the slides, but I will explain to you. So the main conclusions that we found is that the nutritional information is valid for food choices. So here in this graphics, I'm showing that the frequency of reading the label and the frequency of reading the nutritional table on the food packages. And we can say that the first one, showing 27% of the women answered that they always read the labels, and 51% read sometimes, 21% never reads. And regarding the nutritional table, 20% always reads, 42% sometimes reads, and 38% of the women interviewed said that they never read the nutritional table. On the other hand, seeing and understanding the content of the nutritional table, for example, is still a problem for many of those who were interviewed. Regarding the degree of understanding of the nutritional table on your left, we can see that only 21% answered that they can understand all of the nutritional table, and the others answer that they can understand a little bit or part of it or almost it, but they can understand it fully. And we asked also about which information that the women seek for in the nutritional table. And calories and proteins and sodium were the nutrients that they most look for in the nutritional table. We also questioned our interviews about proposal of nutritional labeling, which is called the traffic light. So it is a proposal that is implemented in the United Kingdom to show in the front of the front pack of the package, in the front of pack labeling, the information of each kind of all nutrients and calories translated in colors. So for example, if you have high levels of sodium, you have the red color. If you have medium levels of sodium, it will have the yellow color, and if you have low levels of sodium, you have the green color. And we showed to the women interviewed a package of cookie with this kind of label and asked if they think that this kind of information would be more comprehensive, more easy to understood than the nutritional table. And the majority of the women said that this kind of labeling would be much more easy to understand than the nutritional table. So we know that we still need to understand more how people can interpret this information, but we think that this is a possibility because it brings the nutritional information decodified in colors. People don't have to stay too long reading and making calculations to think, to know if that's too much salt, it's too much fat, or it's too much calories or not. So all this survey is published in a document called Food Labeling and Chronic Diseases, Consumers' Perception in Brazil. It is also available for download in English. The same publication, in the first part you have the Portuguese version, and in the end of the same publication you can read it in English. So regarding our second objective was to evaluate the voluntary agreements made by the Brazilian government with the food industry that propose to reduce the sodium in processed foods and assess their compliance. We have analyzed the sodium content of all food categories included in these voluntary agreements, which were signed between the Ministry of Health and various industry representative associations, which aim to reduce the levels of sodium. We analyzed around more than 500 processed foods labels from different categories, including cakes, cookies, mayonnaise, breakfast cereals, noodles, cheese, bread, instant soup, and others. We also have analyzed in the laboratory the sodium content of these products so that we could check if the information on the labels were according to the real levels of sodium of the products. And for our surprise, there were still some brands that didn't inform correctly the sodium content of the product. So we had some problems about that, but our conclusions that were more important were regarding the goals established in these voluntary agreements. We could see that the goals were very weak because most brands were already meeting the goals when the agreement was signed. So the industry didn't have to do anything and they were already following the agreement. Also, we found a lack of structure of monitoring these voluntary agreements by the government. The government didn't had analyzed many products, and for example, Idec has analyzed more products than the monitoring made by the government. Even with weak goals, some brands still do not reach the agreements. And as they are voluntary, the companies do not suffer any kind of punishment for that. So you can reduce your sodium content or not, nothing's going to happen with you. So considering all the scenario that I mentioned before, we also did another study analyzing the decision-making process of the voluntary agreements. We have conducted a documental analysis of all the agreements, and we have interviewed all the actors involved in this process, including the industry, the government, and civil society organizations. What we conclude in this analysis was that we found more weaknesses regarding these agreements. So we found lack of transparency and lack of social participation and control. So it was just an agreement between these two parties, and the society could not be a part of it. The university, the medical associations, nutritionists, any of these actors were invited to discuss about the goals, to see if it was going to bring some benefits for the population or not. And so what we could conclude is that these weaknesses are compromising the positive impacts on the population's health. So the industry say we are doing our part, but what we see in practice is that this is not enough. We need to establish more strict rules for this to work and for us to have really any positive impact in the health of the population. This analysis are also published in another document available for download in English and in Portuguese too, and I can give you the link afterwards. So moving to the last part of the presentation, our third and fourth objectives were related to food marketing regulation in Brazil. Our first study was to investigate the barriers to enforcement of an existing government regulation on the marketing of food and drinks with high amounts of sugar, saturated fat, trans fat, sodium, and low nutrient content. And after that, we also studied the legislative proposals in relation to the marketing of food and drinks and the barriers to their adoption and enforcement here in Brazil. The first part is related to a resolution published by Anvisa, which is the National Agency of Sanitary Surveillance here in Brazil. Anvisa published a resolution in 2010, but it is suspended by judicial decisions until today. The aim of this resolution was to ensure the information to those which were exposed to offer advertising, publicity, information, and other related practices, whose proposal is to disseminate commercial promotion of foods high in sugar, saturated fat, trans fat, sodium, and drinks with low nutritional content. This resolution specifically had one rule. It was going to obligate all kinds of food marketings and publicity to include a warning about the dangers of excessive consumption of these nutrients that I mentioned before, through messages, such messages like the following: this food has a high amount of sugar. excessive consumption of sugar increases the risk of developing obesity and tooth decay. This was the main role of this resolution. So we analyzed the decision-making process of this resolution, the Anvisa's background on advertising regulation. This agency had already tried to regulate advertising of drugs, but they were not succeeded to. We also analyzed the public consultation that came before the publication of the resolution, and how was the participation of different stakeholders in this process. We also highlight the influence of business associations in different areas, including influencing the general attorney of the union and the judiciary system. These associations had discussed two main arguments. Does Anvisa has or not the power to regulate food advertising? The regulation hurts the commercial freedom of speech of these companies or not? These were the arguments that were discussed in the judiciary system, and are the arguments which are until today being discussed, and the regulation is suspended. So what happened was that the business community pressured was able to reduce the power of Anvisa since the rule was changed and considerable between the public consultation of 2006 and its publication in 2010. In 2006, the resolution included many more rules, but in 2010, it was published just with one rule, which were the messages. There were 11 legal processes to suspend this proposal. So with this process, the Anvisa had not had any power to change this situation. And also organizational changes at Anvisa in 2012, aligned to interests of business groups, contributed to the agency withdraw on the issue of regulation of food marketing. So Anvisa, anyone that works at Anvisa today, if you talk about food marketing regulation, they say, "Oh, I'm not going to talk about it. We don't want to discuss this issue anymore." So, considering this frustrated tentative, we also tried to analyze the bill proposals on advertising of unhealthy food and drinks. Our objective was to evaluate the legislative regulatory initiatives on the marketing of foods and drinks with high amounts of sugar, fats, and sodium, etc. In this study, we tried to understand how the National Congress has been working in the production of law projects on food advertising, if these projects are suitable for health eating promotion, and if there's some kind of legislative proposal in relation to pricing or taxation policies to discourage the consumption of unhealthy foods. This analysis, we found 81 bill proposals, 62 from the House of Representatives and 19 from the Senate. The main topics included on these bill proposals were to restrict the marketing of gifts and toys associated with foods, to change nutritional composition, to restrict the marketing and advertising of food in schools, to restrict food advertising and bring those warnings that Anvisa tried to approve, but it didn't work, taxation, rules for labeling information, and others. We consulted experts on food and nutrition about which were the most important bill proposals, which were more comprehensive and appropriate according to the themes. And we have also published which were the bills that were considered better according to these experts. In relation to taxation, we do not have any bill proposal for the promotion of healthy eating today here in Brazil. The ones that exist, they only want to give subsidies to those who reduce their calorie content, for example, but not to tax the ones with high amounts of sugar, fats, and calories. I will not have time to speak about everything, but all of these results are also published. You can download this publication in English and look through all of these results if you like. And just to finish, I'd like to highlight that this year the World Consumers' Rights Day focus on consumers' rights to healthy food, and together with Consumers International, we are working on a campaign to pressure the World Health Organization to develop a global treaty to support consumers' rights to healthy food, such as we have the one with regarding tobacco, which was very successful. We think that we need another treaty like that for healthy food. This would include the reduced levels of fat, salt, and sugar in everyday foods, to reduce the marketing of junk food for children, provide clear nutritional labeling, and improve the standards of the food served in public institutions. So I think this campaign is very aligned to our work here at Idec, and for our next steps, we would like to disseminate this campaign and participate in this process for the discussion of this global treaty. So thank you very much. I am available for your questions and commentaries, and I'll be glad to talk to you. Thank you very much.
Thank you very much, Anna. That was such a great overview and highly focused on the individual consumer as well, which I appreciated personally. Stemming from the campaign which you touched on, I'm sure that spurs a lot of ideas and questions from both our viewers and those who are participating in the call. Obviously, that there's room for action to be taken. You spoke to the success of prior treaties, for instance, tobacco, and we've seen a lot of changes in that recently. So at this time, for those that are joining us or perhaps joined the call late, so this is another session of our YP Speaks by the Young Professionals Chronic Disease Network. We have Anna joining us from Idec in Brazil, and at this time I'll ask our participants who are sitting in on the call to field any or throw out any questions for Anna while we have her time. And a reminder for those viewing that the question and answer box is enabled if you do want to submit a question in that manner. Now maybe I can prompt Ashley. I know you have experience in this wheelhouse, in this field. So perhaps you could interject and present your viewpoint or any comments that you have on Anna's presentation. I'll just have you introduce yourself as well, if that's all right. And Ashley, are you there?
Sorry, I was just talking for like the past 2 minutes. Can you hear me now?
Yes, yep, that
okay,
works
perfect.
Beautifully.
Okay, I was just chatting to myself apparently. I'll start again. So yeah, my name is Ashley Stram, and I am a PhD student in population health at the University of Ottawa. And my dissertation work looks at the impacts of international trade and investment agreements and how those impact the food supply and our capacity to introduce new food regulation. And I do have a question, particularly pertaining to the last point and the next steps of the project. So one of the things I've been trying to follow pretty closely what's going on with plain packaging in Australia, and the different avenues at the national level, at the WTO, and as well through the bilateral with Hong Kong. And one of the key pieces that it seems that they're drawing on to support plain packaging has been the FCTC. So the instrument is obviously vital to that case and vital to a really important public health measure. But when you look at what it took to get the FCTC in place and just the sheer amount of evidence that they needed to be able to create an instrument like that, what I'm wondering is, for food, do we think that we're at that point yet? Do we have the evidence base that the FCTC needed to be created? Do we have it for food? And if we don't, how far are we from that goal?
Hi, Ashley. Thank you for your comments and questions. I think that's a very important issue. I am not participating in this process very closely, so I will not have many details to tell you. But what I know is that, for example, regarding food marketing regulation, I think we have evidence enough to discuss at least some kinds of strategies to regulate food marketing. And what we see is that the countries for themselves are not being able to approve any kind of food marketing regulation because of the pressure of food industries regarding that. Regarding other issues, for example, food taxation, I think maybe we still need more evidence-based studies to analyze this impact, but we already have some experiences in some countries that are already implementing these policies, and I think we are moving very fast regarding this evidence production about this issue. So I think we are able now to start a discussion. Maybe we will not be ready in next year to have a whole treaty already elaborated, but I think we are able to start this discussion and to analyze which of these food regulation strategies are able to, we have enough evidence to apply and to have a treaty regarding these issues.
Great, thank you.
And it seems my microphone was muted as well. My apologies. Thank you very much for that comment and question, Ashley and Anna specifically, both providing high level as well as those micro level details, which make this conversation and this discussions richer for those that are viewing. At this time, I don't see any other questions from our viewership body, but for those that will be joining us afterwards, I will extend an offer to contact Anna either through our YP blog. Feel free to reach out to both her as well as the YP, which is our handle NCD Action on our Twitter account. So questions and continued discussion are encouraged stemming from this. Once again,
sure,
on behalf of I'll thank you again on behalf of the Young Professionals Chronic Disease Network for joining us today, and for those that took time out of their lunch hour or evenings or mornings, whichever time zone you are in. So yes, we'll be having another YP Speak session in the coming weeks, and I can be reached as well to contact Anna for publications or further inquiry. Thank you to those that are joining us today. Thanks,
Anna.
Anna.
Much this day. Thank you. It was a pleasure.